Today's video is going to discuss pulmonary hypertension. This video is geared more towards physicians, from medical students all the way through cardiologists and patients, but patients that have the disease may be able to pick up some of what I'm trying to explain in the video. There's a term that is loosely used called cardiorenal syndrome, which all that means is there's a disorder that's affecting both the heart and the kidneys. Well, one of the most common causes of when people say a patient has cardiorenal syndrome is what we call pulmonary hypertension. Well, what does that mean? The right side of the heart is a much weaker portion of the heart than the left side of the heart. It's a thinner structure when it comes to pumping against the lungs than what the left side is. Left side is much thicker, and it is thinner because it doesn't have to work as hard. There's a blood pressure out here in the body, for example, that may be 110/60. But a normal pressure in the lungs, which has this completely separate vascular system, is 25/5 in a normal healthy person. Well, the right ventricle has to pump against a pressure of 25, so it only needs to generate a pressure of 30 or 35 in order to get blood to go forward. If your blood pressure out here is 110, your left ventricle, which is what pumps out to the body, needs to generate a pressure of 120 or so. When the pressures in the lungs go up, regardless of what the reason is, let's say the pressure is 40/15. Well, now the right ventricle needs to generate a pressure of 45 or 50 to pump across the higher pressure in the lungs. At some point, it gets too difficult for the right ventricle to pump blood against the higher pressure of the lungs. So the left side of the heart, so blood goes from the lungs to the left atrium, the left side of the heart doesn't get enough blood flow, so there's not enough blood that gets pumped out to the body. And it's problem number one, because then the blood pressure tends to go down and less blood gets pumped to the kidneys. But the other problem is when these pressures are higher, the right ventricle is trying to pump against this higher pressure. It can't pump against the pressure, so it doesn't empty the contents within this chamber as well, and fluid tends to build up. And that fluid builds up usually in the lower extremities and in the abdominal cavity, so you can notice initially that your ankles may get swollen or the calves get swollen, but eventually the belly gets swollen as well, and you have fluid that builds up within there. So that's what happens with elevated pressures in the lungs. I hear more frequently doctors or residents say, oh, the patient has cardiorenal. And saying that is just like saying, oh, the patient has congestive heart failure. Congestive heart failure only means, if it's used correctly, that the heart's not meeting the body's demands, essentially. Cardiorenal just means there's something wrong with the heart and something wrong with the kidneys, and there could be any reason. So saying congestive heart failure, you need to figure out what the issue actually is. Saying cardiorenal, you need to figure out what the issue is. Don't just say a word and not get to the underlying diagnosis. This specific video refers to pulmonary hypertension, as I said, and that often causes cardiorenal syndrome, where the kidney function is perfectly fine, the left ventricle is perfectly fine as far as how it squeezes and relaxes. It's just blood can't get to the left side of the heart, and in turn can't get pumped to the kidneys. Typically when a patient comes in and they've built up fluid, we'll give them diuretics or water pills. Diuretics are great because it decreases the amount of volume in the body. The problem is, if the pressures in the lungs are too high, the only way to get rid of fluid with diuretics is to get more blood to the kidneys. So the kidneys get more blood. When they get more blood, more of the fluid essentially gets taken out of the blood and urinated out. Well, those kidneys aren't getting enough blood flow in the first place, and you give them a diuretic, then all of a sudden the blood pressure gets even lower, the kidney function gets worse, and you're really not getting rid of any of the fluid which is on the venous system or the right side, so within the abdominal cavity or the legs. That's what you're trying to address, and diuretics oftentimes don't work. It then gets to the point, what's causing the pulmonary hypertension? And there's a subclassification. I'll put a link below for people that are interested in looking, but there's 5 main classes of pulmonary hypertension. If it's related to blood clots, for example, treating people for an issue with the lungs themselves won't do anything, because the problem is there's too many clots in the arteries in the lungs, so blood can't get from the right side to the left side because there's clots in the way. If someone is obese or overweight, where the pressures in the lungs are too high and that's compressing the arteries, giving blood thinners, which may help the arteries if there's a clot, isn't going to help that. So once someone has pulmonary hypertension, finding the underlying cause is the most important thing to do to treat it. And we have different treatments for the different causes of pulmonary hypertension. Some of those treatments are more advanced where you might not find them at small non-academic centers. And if somebody does have a diagnosis of pulmonary hypertension and you're a patient who's told there's nothing we can really do for you, going to an academic center or a larger institution may be beneficial because there may be drugs that are helpful that other physicians or offices may not have access to. Oftentimes, by the time a patient is referred to me because of pulmonary hypertension, we'll do what's called a right heart catheterization. A right heart catheterization, we put an IV either in the neck, we can put it in the leg, but there's different areas, but we put an IV in, and through that IV we have a catheter that goes into the heart in the beginning part of the lungs, and we can measure the actual pressures. And it's helpful for two reasons. Typically, we're getting information from ultrasounds or echoes, and that's non-invasive testing, but we're estimating what those pressures actually are. We're not actually measuring directly. Catheter measures the pressures directly. The other thing that we do is when we have a catheter there, we can give patients different medications through IVs to assess how we affect those pressures with different drugs, which in turn tells us when a patient does leave which medications are going to be more helpful or which medications are going to be less helpful for the patient. Obesity and sleep apnea, which significantly raise the pressures in the entire chest cavity, regardless of the underlying diagnosis. For example, if somebody does have clots in their lungs and are told they have pulmonary hypertension as a result, the clots may be what tipped the patient over to cause symptoms. But if somebody's got a body mass index of 30 or 35 and or sleep apnea, and those aren't addressed, that's also contributing to the problem. So for those patients, it's even more important to get weight down, that they have sleep apnea, finding what the cause of the sleep apnea is and appropriately treating it. Unfortunately, I see too many patients coming to me as far as second opinions or third opinions, being told they have heart failure or their kidneys are failing and they wanted to see somebody else before they go on dialysis. And I look at the patient, I oftentimes bring up, has anybody talked to you about the higher pressures in the lungs? And it's not something that unfortunately a lot of physicians initially think about or look at. So it is important, if you have a buildup of fluid, you may want to ask your doctor, are the pressures in my lungs much higher than they should be? And is that affecting my heart instead of the heart being the cause of what my problems are? I hope you found this video helpful. If you have questions at any time, please let me know. Enjoy your afternoon.